Hello, I'm Jawad Husain. I'm the Executive Medical Director at East Lancs. This is my update on the week beginning 14th of November 2022. You probably are seeing my colleague Vicki Stevenson-Hornby with me. She's a specialist nurse in HPB and will be talking about pancreatic cancer. But before we go to Vicki and ask various questions on which I'm sure she'll update us, let me give you a very brief update of how things are within the organization. A few things in regarding to some national initiatives. One, as I started with saying, this is the month for awareness of pancreatic cancer, and Vicki will be talking a bit more about it. It's also the month of November, which is emphasizing on prostate cancer, its awareness, its detection and treatment, and so it is also for mental health. So please do look at the initiatives which we regularly update on our website. Finally, this is also a week for self-care awareness. It's emphasizing how important it is for one to look after their well-being, whether it's mental or physical health. So anything from exercising to ensuring that you access any support should you be suffering from any element of mental anxieties, depression. Our teams are updating information and resources, so do look after your well-being and also your loved ones. Now we move on to asking Vicki to introduce herself, the role she plays in the organization, and a bit about what pancreatic cancer is, what can be done. I've asked a lot, Vicki, in this one go, but I think it probably gives you an opportunity to just explain without me having to interrupt any further. And finally, I would just like to say, you are seeing we are in a small office. This is Ward C14. This is one of the surgical wards where we provide all forms of care. And on to you, Vicki. Thank you.
Thank you. So I am a specialist nurse for pancreatic cancer and for hepatobiliary cancers, but for the rapid diagnostic service. So trying to get an earlier, speedier diagnosis of these cancer types. November is Pancreatic Cancer Awareness Month, and unlike some other cancers, there is no screening programme for pancreatic cancer. So we are very much dependent upon a person really becoming unwell, experiencing symptoms in order that they can present. Self-examination isn't possible, so we're really keen to raise awareness of early symptoms. So things like abdominal pain radiating through to the back, weight loss that isn't intentional, that has happened and you've not been trying to lose weight, jaundice, so yellowing of the skin or the whites of the eyes that has come quite suddenly, which could also lead to changes in the colour of urine being dark, changes to bowel movements which may be pale and they may be difficult to flush. All of these things may be signs or symptoms, and we would urge people to get medical advice as soon as possible with any of those symptoms. There could be signs of other illnesses, of course, but it is really key that these things are looked into so we can rule out things like pancreatic cancer earlier.
Yeah, no, thanks, Vicki. Just leading on from there, if somebody unfortunately does get pancreatic cancer, how can they be treated and helped? In particular, people with early disease and people with then a late disease presentation. What is there for sort of help that we could offer them?
Okay, so if it is an earlier diagnosis and therefore we're able to offer maybe surgical interventions with an earlier diagnosis, so they may be able to have surgery which would be done here at Blackburn, and then they would be cared for afterwards, initially on the ITU, on the intensive care unit, and then here on one of the surgical wards, which is where we are now. If it was a later diagnosis and the cancer is quite advanced and we're not able to operate, which unfortunately for these patients that is the majority of people cannot have surgery, then we may be able to offer chemotherapy in order to try to stem the disease or keep it as stable as we could for as long as we could.
All right, thank you. I know it's a huge topic, and I know that our teams is going to put on information on our website, so I'll encourage colleagues to look into it. And finally, as you could see, Vicki is very dedicated nurse, and in keeping with this month, she has colored her hair purple, because that's what we are saying, that purple is the color that Pancreatic Cancer Awareness Month reminds us of.
Yeah, and on the topic of purple, Thursday the 17th of November is World Pancreatic Cancer Day, where we kind of urge and encourage everyone who can wear something purple, turn it purple, just to raise awareness. There'll be lots of landmark buildings across the world who light up purple, and I know some of my colleagues are embracing the purple, maybe not dyeing the hair, but they're going to wear some purple items of clothing to raise awareness.
Well, thanks very much, Vicki. And finally, as we are in the process of making people aware of various pathologies and disease, on the 14th of November, it's the World Diabetes Day. Now, I'll try and see if in the coming few of our visits to various wards, we can bring our colleagues who deal with diabetes. Diabetes is a fairly debilitating disease, and I think it's probably fair to say it's a silent killer, unfortunately. So we'll try and bring an update to you on this, but on that I'll bring an end to my update. Wishing you all the very best. Look after yourself and your loved ones. Bye for now.